40 crore people are affected with knee osteoarthritis. Okay, so it means that the number of osteoarthritis patient, okay, is growing every year. So it is necessary to understand what is the root cause for osteoarthritis. Or in general, commonly we used to say that the knee pain. The knee pain is a one general terminology, but it is due to various reasons. We cannot able to say that it is only due to the arthritis, or it may be a muscle weakness or any other reason that we need to address initially. You know that our Indian scenario, we know that we used to say that prevention is always better than cure. That means early detection and you will start the treatment at the early stage is always better actually. That is what the objective of this webinar. The webinar topic is unlocking a pain-free tomorrow, your guide to spotting osteoarthritis early and taking control. So in this session, doctor is going to shed a light on what is meant by osteoarthritis and what is the root cause, symptoms, and apart from that, everybody is nowadays afraid to go for everyone. It is very common thing. People are not ready to go for surgery. But what are the non-surgical treatment options are available? Okay, at what stage surgery is needed? You cannot able to avoid surgery at particular stage. And what is that stage? You need to understand everyone. Okay, that is what the objective of this webinar. Doctor is going to shed a more light on knee osteoarthritis. That is what the objective of this webinar. With that, because the major objective of this, if you go to the YouTube or any social media nowadays, you will get a lot of information. But most of the information you are getting, you will be confused, which is one is the right actually. So you need to consult with the right consultant in the sense, meet the proper consultant, qualified consultant, and take a proper consultation. Then you need to take the next step. That is what the objective of this. Okay. So, Subhashnak, go to the next slide. Okay. Dr. Sai Krishna actually named as an ortho specialist in PRP therapy. You know that it is very, very common nowadays. Everyone knows about, even if you talk to anyone, they know about the PRP. It is widely used. People who are searching in Google or any other thing, they know that what is meant by PRP therapy. Doctor is named himself as a specialist in PRP, means he believes non-surgical treatment option, and he is a arthroscopic surgeon by profession, and he is having almost 22 years of experience in this industry. Okay, he is expert in minimally invasive surgery, and apart from that, he has worked in various hospitals, especially in he has done at Sir John Radcliffe Hospital. That is one of the biggest center in the UK. Apart from that, doctor having very good exposure in sports injury, treating sports injuries. That is what is specialization. So doctor is having a fantastic experience, especially in the treating knee problems, so that you can able to interact with him after his presentation. So I am requesting everyone to mute your speakers, okay, so that you can able to listen the doctor presentation. After the presentation, we are allowed everyone to talk to the doctor. So no worries about that. If you want to talk to the doctor, you raise your hands after the presentation, or you leave your questions in the chat box so that we can able to convey your questions to the doctor. We will answer. Thank you very much to everyone for joining this webinar. And on behalf of Avana Surgical, I welcome Dr. Sai Krishna, sir. Thank you very much, doctor. First of all, I really appreciate your accepted to host this webinar in your busy schedule. Thank you very much, doctor. First of all, for you. Thank you. With that, you can start your presentation, sir.
Thank you very much. Thanks, Ramesh. Hello, everybody. We just want to talk about, I'm Dr. Sai Krishna B. Naidu. I'm a specialist in knee arthroscopy and joint replacements. My area of specialty is knee. Today, we are going to talk about a majority is about knee issues. We believe in preservation, conservation, reconstruction, and revision if required. Reconstruction sense knee replacement, and revision if required if the knee replacement has failed. So we believe strongly.
So sorry to interrupt you. Sir, participants, English is better, or you would like to go for a local Kannada language, which is best? Maybe, doctor, sorry to sorry to say that. Maybe
English
sometimes,
is fine.
Both English and
Thank you.
Kannada.
okay.
Thank you.
Okay.
I will try my best to be in between Kannada as well. Others
Sure.
help, sir. I will tell you.
Thank you, sir. Thank you.
So the first two components of knee is revising or restoration of the knee joint is very important. So knee joint has a cartilage. I don't know whether you can see this picture. The blue lining of the knee joint is cartilage. So what we're going to talk about is all about cartilage today and what problems does the cartilage cause. What is arthritis? So arthritis is an inflammation of one or more joints in the body, and that causes pain and stiffness. We're pretty much focusing on knee today as arthritis. So what it means is this lining, this blue color lining, wears off as time goes by. They're like simple car tire. The more you drive, they wear off. Okay. But there is a balance here. If you don't drive, the rubber becomes brittle. The same way, if you don't walk, this cartilage
ఫోన్ వచ్చినట్టు కదా అదే ఎంగేజ్ ఉందని నేను మళ్ళీ ట్రై చేసి
Rogan, please mute everyone.
So that is a picture which is depicting the cartilage. When the cartilage goes away and that bone spurs which are there, it rubs onto the bone, and that is what causes the knee pain. So this arthritis can affect anywhere in the body, from hip joints to the hands, to the ankle, the shoulder, and also to the spine. So when the arthritis happens to the multiple joints, then it is called polyarthropathy. That is not called osteoarthritis, or it can be inflamed arthritis, something called as rheumatoid arthritis. So the treatment for inflammation and the rheumatoid arthritis is management. And when the medical management or the medications fail, then we talk about surgeries. So coming to the very simple arthritis, what we talk about, who gets osteoarthritis? So osteoarthritis is the most simple form of arthritis, and that is the most common form of arthritis. Majority, I would say 90 people above 50 or 60 experience through this pain, what we call it as osteoarthritic process. Why this happens? So it happens because, as I said, everything in life has a lifespan, okay, on this planet Earth. So is the life for this cartilage. So this cartilage, the blue color lining, has a life of 50 to 60 years. In some, it wears off very fast. In some, it wears very late. Some people can come even at 80 with osteoarthritis because of the genetic make, environmental factors, the joints being healthy, and various other XYZ. So there is no escape, including me, will be a part of the arthritic process. It is a normal process. It is not a disease. Most important thing that you need to understand that people are living longer. So it is a normal process that people experience osteoarthritis. As clearly depicted in this picture, who gets arthritis? With age increasing, majority have. Most of the people are above 50. Above 65, they predominantly have arthritis. That is 66% of the population of 65 age has that. That is in Indian demographics. Arthritis is more common in women than men. The reason there is a prediction difference between the women and men are activity. That is what makes huge difference in the arthritis. The reason is this blue cartilage does not have a blood supply. Okay. The nourishment for this blue cartilage comes only by walking, activity. When you do activity, it starts loading arthritis, the cartilage. The nutrition goes inside the blue cartilage, and that is why it survives longer. So mostly men are much more active compared to women, and that is why you see
So sorry
more
for the
predominance.
interruption, sir. Sir, actually the presentation has been stopped, sir. I think we have to share the screen one more time. Subhash?
Yeah.
Yeah, please share the screen.
Okay, can you see that?
Yes,
Now
sir,
it's fine. You
it's
go ahead, sir.
Yeah. So arthritis is much more common in women compared to men. Arthritis takes much longer in terms of quality of life, and lack of activity significantly reduces the quality of life. The reason arthritis is more common in women are because men are much more active. When you're active, this cartilage, the blue lining cartilage, gets nourishment. The nourishment comes only by activity, by walking. And the nourishment comes through a process called diffusion, where the good nutrition goes into the cartilage and starts to longer. So that is the demographics showing a difference age group between the men and women. So women are much more predominantly having arthritis compared to the men, as explained. So there is a huge prevalence of arthritis in certain part of the population in India. So what we see, I don't know how far it is true. What we see is predominantly North Karnataka, coastal Andhra, coastal Tamil Nadu, Vidarbha has significant arthritis. Gujarat, West Bengal also has significant arthritis. In certain parts of Madhya Pradesh and Uttar Pradesh has, probably because of the environmental factors, water, or genetic XYZ, genetic. So that is arthritis, what we see. That is how the X-rays look when the cartilage wears off. And the picture on the left is a normal joint. When cartilage and meniscus are there, you see the equal distance between the both. That is these things. So when the cartilage and the meniscus wears off, you see the drop on the joint space where touching to each other. Bone is barely rubbing onto the bone, and that causes the pain. So how does the arthritis progress? And this is the pictures of the knee arthroscopy when we see. So you can see on the left side where the normal cartilage is. On the right side, the cartilage is moderately worn off. On the extreme right, you can see the bone clearly seen along with the cartilage, with huge defects and the craters with the severe arthritic process. So there are grades of arthritis from grade 1 to grade 4. Grade 4 is where the joint space is completely reduced and the bone is barely touching onto the bone on the side.
Osteoarthritis is among the most common joint disorders and is characterized by joint pain due to wear and tear of the joint. This animation demonstrates the progression of the condition through 4 stages. Here's a healthy knee with healthy cartilage allowing for smooth motion. Grade 1 is partial damage of joint cartilage, characterized by minor bone spurs or osteophytes, as well as very minimal joint space narrowing. Grade 2 has moderate cartilage damage with definite osteophytes or bone spurs and apparent joint space narrowing. Grade 3 has multiple osteophytes or bone spurs with definite joint space narrowing with apparent sclerosis of the bone. Grade 4 is the most severe. It's bone on bone with multiple large osteophytes or bone spurs with marked joint space narrowing and severe sclerosis.
So that's the different grades of arthritis where the video depicting or showing how it progresses. How do we diagnose this? By using the X-rays. We predominantly use standing X-rays so that the weight bearing shows if there is a wear in the cartilage. If you do an X-ray while lying, it will not clearly show the true picture of the wear and tear or the extent that you have the wear and tear. What are the early signs? Early signs are crackling and clicking, mild swelling, pain, lack of activity because of the pain, bone spurs on X-rays, stiffness, early morning stiffness, and reduced flexibility, including your quality of life. What are the risk factors for the knee osteoarthritis? As I said, we are talking predominantly of osteoarthritis. We're not talking about the other forms of arthritis, such as rheumatoid, inflammatory, and psoriatic arthritis, etc. Risk factors for osteoarthritis: inactivity is a risk factor. Okay, get BMI, the patient other things. Environmental factors, sport activity, they have cartilage damage. Their disease can't be only be prevented and delayed the process of it.
Voice is breaking, sir.
Osteoarthritis is a wear and tear. It's a normal process. It cannot be cured. Can you hear us now?
So now it is okay, sir. In between, there is a disturbance, maybe due to the network issue. Maybe now it is clear.
Yeah. Okay. Okay. So it can only be cured. So there is no way that anybody can escape. Maybe 1 in 100 might escape because of their very good genetic make, but this is a normal process. So how do we cure? Obviously, keeping healthy diet, regular activities, prevent overweight, keep the muscles strong. There's a huge graph showing all this, where it keeps your cartilage healthy and active. So how to prevent? As I said, we cannot prevent, but we can support the structures around it. Okay, we can delay the process of it. Okay, so the muscles around the knee joint are very, very important. If you do good exercises and keep your muscles strong, so the load on the knee joint is reduced. So when the load on the knee joint is reduced, obviously the slowing process of the arthritis happens. Okay, if the muscles are not strong, then the wear and tear happens much more faster. That is why we emphasize on activity, walking, and regular exercises. Okay, specific muscles such as quadriceps muscles. Once we have a physiotherapy consultation, they will explain you what are the best muscles to strengthen the knee joint, or specifically for the hip, if there's a hip arthritis, the abductors, and for shoulders, the other muscles which are specifically targeted in terms of strengthening them. So exercises, weight loss, and certain aids which help in prevent further damage of the arthritis, which we're going to briefly talk on this webinar. So the benchmark for Orthopedic Society is American Orthopedic Association, where you can see their website clearly mentioning certain aids which help them in delaying the process of the osteoarthritis. Strengthening exercises is shown to very strong recommendation. Low impact aerobic exercises, aquatic exercises, and weight loss programs. So obviously we have established that the osteoarthritis is a common phenomenon that everybody goes through. Eventually, when the wear completely happens, and that is where you need surgical treatment, what are the things that are much available before surgical treatment? Are the ones which we're going to go through. So obviously your medications are prescribed by your local GPs and doctors. They can prescribe you some non-steroidal inflammatories. So how it works? Because when there's a cartilage wear happens, there is a bare bone rubbing onto the bone, causing inflammation. So that inflammation causes a swelling, and swelling in per se causes a return in pain, severe pain. So these steroids reduce the inflammation and keeps the pain at bay, and that's how it can help you. But long-term use of steroids do causes a lot of problems, such as gastrointestinal bleeding, kidney failures, not good in diabetics, which can cause significant amount of renal damage or kidney damage. So physical therapy, that is exercises, manual therapy, ice packs, thermotherapy, electrotherapy, which physiotherapy uses to you. These all are temporary measures to keep the pain when there is an inflammation process. So your pain comes and goes. It's not a continuum process. There's a period of pain for a few weeks, 2 or 3 weeks, and then it goes away. So that is the time where the physical therapy and manual therapy helps, because when you rub and massage, naturally the pain tends to settle down, and that's how the inflammation settles down. So intra-articular injections seem to help in certain populations, PRP and BMAT. who are these population who can be beneficial? They are the people who are in early stages of grade 1 and grade 2 osteoarthritis. So grade 1 and grade 2 are the early stages of osteoarthritis. It's like an early cracks in the cartilage. So it's like it's the synonym or an example that I can give you is if you have a tar road in front of your house and there's a little cracks. So what do BBMP do? They come and patch up that little tar road. So that's how the injection of PRP, which can be filled into that and give you a bit of beneficial for PRP injections and help you in preventing or further damage for a certain period of time. It's not a permanent treatment, but it will give you pain relief and prevents damage. It keeps you healthy. So the same tar road, when there's a significant damage, what do? And lay down the new road. That's what we call knee replacement. So this PRP and injections are beneficial at the early stage of osteoarthritis. It does not benefit them at stage 3 and stage 4. They would benefit briefly for a period of 2 to 3 months and they recur back with the symptoms. So how do we prepare this PRP? Regenerative therapies, they're shown to have very good results in early stage of osteoarthritis. What we do is blood from your body and we filter certain cells, what we call healing cells. These cells are re-injected back the platelet-rich plasma. So these platelets go down to that cartilage area by creating a various growth factors which are there inside those platelets. And that's how the growth factors help in healing the broke cartilage in early stages. So how do we prepare? As I said, we take blood, we do centrifuge, and Arthrex has a very good kit which prepares a very platelet-rich plasma in that, and we inject about 3 to 4 ml into the knee joint. So what are the other options we have? In early stage of osteoarthritis, most of the people have arthritis in the one compartment, not on the both the sides. That's how they start. Okay, and that is what you can see on the picture. So when you see such stages, these braces, offloading braces, what we call, are very, very, very beneficial. Okay, they give you complete offloading and they do not let the bone touch onto each other. It helps in 2 ways. It helps in preventing further damage of the cartilage, one, and delay the process of arthritis. Secondly, it gives you a complete pain-free for your daily activities. And I know personally one surgeon whom I'm treating who's been wearing an offloader knee brace for almost 6 years and the process of partial knee replacement. In such cases, you can see them where there is a small defect or the arthritis happening only on one side. We also do partial knee replacement, not the full one. We partially replace only the one condyle where it is circled. But prior to that, we give you a good trial of knee braces to see if that benefits. And majority accept that and start doing their normal activities. Other options are compression sleeves, and these are temporary relief, but they don't have any evidence to support that they can prevent any further damage of osteoarthritis, but they give sense of security to the patient in terms of feeling good in terms of preventing the osteoarthritis, which American Orthopedic Association recommends strongly, and also I recommend all my patients in terms of keeping the muscles strengthened. Other things that we can do, eat supplements, eat rich food of essential oils, wear a knee brace in terms of osteoarthritis. Thank you very much for listening. More than happy to answer any questions if you all. I hope.
Yeah, thank you. So, yeah, sorry. So, I have a question, or should I wait for? Okay.
Please. For a wonderful presentation. Very thank you, sir. Sir, before we have to jump into the Q&A, interact with others participants, I would like to, with your kind permission, I would like to go for a small presentation when you are discussed about the offloading braces.
Yes.
Because when you want to get a comparison between the normal braces and offloading braces. So participants, let them understand what is the difference
That will
between
be really
braces and
helpful,
braces.
Ramesh. Yes.
Yeah, sure. I'll go for a small presentation. Just
Yes.
few minutes. Just a minute, sir. I am sharing my screen now.
Yeah, the offloading braces have shown significant amount of benefit in my patients, at least, because they all come in a very early stages of arthritis. And for them, some people have recommended knee replacements, but they are predominantly on one side of the arthritis, which they don't need. So they do have a choice of avoiding the surgery for at least 5 to 7 years by wearing the knee braces. Offloading knee braces are the only knee braces shown to beneficially delay the process of osteoarthritis with one compartment. They are using these half knee replacements and high tibial osteotomies with one side osteoarthritis in a populations of age 60, 70, and also 90 in Japan to a certain extent. Because if you unload where the arthritis is happening, the other side seems to be settling down and the delay of osteoarthritis happens. I'll let you talk, Ramesh.
Yeah, thank you very much, doctor. You are given already state for me to talk about the offloading braces, because when it comes to the osteoarthritis, the major problem is the weight. Okay, the weight goes to the particular compartment. That's why that wear and tear will happen on that particular compartment mostly. So most of the time that 90% of the patient's weight goes to the medial compartment, that is on the inside of the knee. Okay, so with that, I would like to just give some small brief about what is mean by offloading braces. Brace is nothing as an external device which is going to be fitted on the affected or injured part of the body. And there are multiple braces are available. It depends upon the indication, by, for example, post-operative or preventive. Okay, so for rehabilitation, so many things are different braces are available based on the individual need. So in market, mostly you know that the compression, which is one you can able to see in the screen on the right side, the white one, which is very quite common. Or even if you Google or you can go to the any other social sites, you can see this lot of braces are available in that. Whether really it is going to be beneficial, that is what we need to differentiate between what is the meaning of offloading and what is the normal compression sleeve, how it is going to help. So if you see that offloading means, so very simple, the name itself, it resembles offloading means it transfer the load from the affected to the unaffected side, because the major problem is weight goes to the particular compartment. That's why the wear and tear will start. Mostly 90% on the medial side. If you see on the right side of my, if you see that, if the damage happened on this inside, the knee goes into this manner. This is called a bowed knee. Normally they said actually, varus condition, this is actually. So then what we used to do, the brace, normally putting this type of 3 pressures with this type of hinges, it pushes from the opposite side, open the joint space. That is what the basic of this offloading brace. But when it comes to the compression sleeves, there is no such mechanisms are not available. But it gives some pain relief. I'm not going to talk about against the compression. It also gives some compression, and the compression which is beneficial for sometimes the pain relief. But whether it is going to stop the pain and whether it is going to stop the disease progression, that is what the matter actually. So in that manner, compression knee sleeves are not doing that purpose. Only knee offloading braces are doing that because it is going to increase. You see that small presentation here. If you see that on the X-ray, this is the without brace, the patient's X-ray. If you see that the joint space is not visible at all. There is the bone, the femur, that the thigh bone and the another tibia is touches together. There is no joint space. And in the opposite side, another side, you can see the X-ray, where you can able to find out the brace image, as well as you can see the increased joint space. Obviously, if there is a small incremental increase in the joint space, definitely it stops or reduce the pain, and at the same time, it slows down the disease progression, because there will not be a chances for wear and tear. That is what the offloading knee brace. If you see that, what is that benefit of this? You can see this video, how the braces will work.
Greg OA braces gently apply pressure to the unaffected side to align the knee, taking pressure off of the affected side of the knee. The higher the number on the thumb wheel, the greater the amount of force on the knee. These before and after x-rays show how Greg's freestyle OA brace affects the knee. Ask your doctor.
Okay, so always better to consult the doctor before you are going to any type of braces. It is not mean only for the off-roading brace. Even any braces, better to consult a surgeon so that you can able to find out which is the right brace, because you know that you don't know exactly what is the root cause, which is responsible for that. So you need to identify the right problem, and the consultation. After consultation, you can go for any braces. So what is the benefit of this product? Actually, very simple wraparound design. Even elderly patient, they can able to wear very easily. Okay, and then it gives a compression. You can wear the dresses also over that. It will be very easy. If you are feeling a pain, you can adjust yourself. No need to wait for someone to come and do that. So it is a very simple off-roading brace. If you see that this is one of another patient's X-ray, you can see that, and you can see visibly the joint space. So this is the major benefit of freestyle OA knee brace. In India, more than 6,000 patients, happy patients are there. If anyone wants to try this brace, free trial, we are ready to give it in Bangalore. You can register after this program. Our people will come to your doorstep and they will apply. You can feel the product. So another one more braces also available. If the patients are a little bit higher BMI, this type of braces sometimes will help, because if there is a ligament injury along with the osteoarthritis, this type of braces will help. And if you see that this is a offloading can be done with the Allen keys, but it is a traveling on both the side, it offloads. You can see this patient is struggling to walk on the staircase. If you see she can able to walk very easily without any support, and you can see that how confidently she is walking. She is not able to walk more than 4 years, and she started walking. You can see the shoulders. Most of the time when there is osteoarthritis, most of the time varus condition, the shoulders, that is called a guide position, normally it's not equal. But if you see that she is walking without any guide deviation, she is walking fast confidently. Thank you very much. This is about the difference between the other normal braces and the off-roading brace. Maybe you have a idea right now by off-roading braces, how it is beneficial for you. Thank you very much. Thank you, doctor.
Thank you. Thank you very much.
1 minute, sir. I will stop my presentation. 1 minute. Maybe now we'll
ask me a question with what is the diet we can do and what exercises. The diet is very simple. Eat when you're hungry, very important. Most important is a nutritional diet. Secondly, exercise is simple walking. Aim to walk at least 10,000 steps a day, which will be enough for your cartilage to nourish it, or the joint to be rejuvenated every day. Other message somebody sent me. Yeah, that's it.
So that is one question actually.
Yeah.
So what we do now, we'll go for one by one. Some people are raised already their hands. One by one, we are allowing. Uma, you are asked something. You can ask to the doctor now. Yes. You can unmute and talk to the doctor. Okay. I think she has not asked anything.
Yeah, Uma Kurana is the one who asked this.
The next one, Deepa. Maybe they are not done that. Sujata, ma'am, you are asking now. You can go ahead with the doctor now.
You are more than welcome to type the messages also. We are happy to.
Okay. Good evening, doctor. Can you hear me?
I can hear you, Sujata. Please.
So, doctor, I just was quite keen on the PRP therapy.
Okay.
I was told that I am in the grade 2. So, what would be the approximate cost if I want to do the PRP in both my knee joints?
Okay. Each knee joint will average cost about 70 to 20,000. The kit that we use from the company called Arthrix, the kit charges about say 7,500 to 8,000, and that's the cost of the kit. And we prepare that and we inject into the joint in the clinic. The same thing if you do in the hospital, the charges will be somewhere about 70 to 80,000.
So, doctor, how do we get it from you if we want to?
We will connect you. Subhash will share the details of the clinic.
Sir, sorry to interrupt you. Ma'am, don't worry. After this presentation, after the doctor webinar, in the WhatsApp group, we are going to communicate all the details, how to talk to how to contact the doctor, getting the appointment and all. Okay, if anybody wants to talk to the doctor, definitely you can go and ask directly. You can contact. Yeah.
Okay. So, doctor, another question is there any particular diet which actually you said that everyone might end up in osteoarthritis?
Yeah.
But is there any particular good diet or vitamins which anyone should take to avoid it? I mean, to prolong the.
Yes, multivitamins post age 50 is recommended. There are a lot of multivitamins available. Essential minerals like selenium, magnesium, good protein, good quality protein helps to regenerate the cartilage. Okay, but to keep the cartilage live or alive, you need a good synovial fluid, and that synovial fluid comes out into the joint only by you doing activity and walking.
Okay. Thank you so much, doctor.
Pleasure, ma'am. Pleasure. ಕನ್ನಡಲ್ಲೂ ಕೇಳಬಹುದು ಕ್ವಶನ್ಸ್ ಕನ್ನಡಲ್ಲ ಆನ್ಸರ್ ಮಾಡ್ತೀವಿ ನಾವು ಸೊ
next Sagar.
Yeah, thank you for calling.
Ask in Telugu. Smita Madhusudan has asked a question. Why do we feel chills around the knee? I'm diagnosed of stage 2 and stage 3 arthritis. Ma'am, the reason you feel chills is the weather. Usually the nerve endings around the knee joint or anywhere in the body are quite receptive to the weather. The cold weather causes you more freezing kind of things, and that is why you feel more pain during the cold winter weathers.
Yeah, Mr. Sagar, you go ahead now.
Yeah, thank you. So, doctor, let me take from the point which you just told, like regeneration of the cartilage. So, I'm 30, and initially the pain started with one knee after my Himalayan trekking. Trekking means successful, but after 1 month it started. But now, after 6 months, both the knees are paining. So, what doctor told is that, first of all, to not use brace because it will increase stiffness. He told cartilage cannot be increased. So, my question now is, if it is grade 1, counter Malaysia, or whatever the pronunciation, counter Malaysia patella, is it same as osteoarthritis, or these both are different things? Can we regenerate the cartilage?
No, they both are same, but here counter Malaysia patella means it is the arthritis behind the kneecap. Okay, it is not on the knee joint, it's the kneecap which is causing that. And the reason you have that is because of the weak muscle. So if you come down to clinic, I'll be able to explain why this happens. The reason that happens is because you need to understand a picture called lever arm, and that's how the nature is designed. Okay, so the lever arm is what you lever onto the kneecap, and the load is happening much higher. So if you consult us, we will be able to explain you why that is happening. And contra Malaysia patella grade 1 is reversible just by exercises. Nothing else is required.
Okay, because doctor, last one. See, people are telling that when I have this, I'm not supposed to cross leg and sit. So when I'm doing exercises, few exercises are demanding that, just holding of the knee. So is it, if I build the muscle, respective muscles, then is it really reversible, that contra Malaysia patella issue?
Yes, contra Malaysia patella grade 1 and grade 2 is quite reversible, provided you strengthen your quadriceps muscle. Okay, crossing your legs, eating certain diets will worsen is a myth.
Okay.
There is no proven evidence to say that. Okay, so don't worry about it.
Okay, doctor. PRP is not suggested for this, if I'm not wrong.
It depends on what stage contra Malaysia patella is. We usually take our decisions based on the MRI images that we see, because most of the reports are not done by specialists.
Okay, thank you, doctor.
Thank you very much, sir. Sir, I have one question now, because when it comes to the contra Malaysia patella, most of the time, and traditionally, our people will sit and take the food on the floor. Yeah. Whether it is good or we need to go for any other alternative.
No, bed is shown to benefit longevity of your knee joint because stiffness is prevented and range of movement is kept. Sitting down is very good. The reason we don't recommend post-knee replacement is because of the elderly population. If they're younger population with a strong muscles, we ask them to cross their legs and sit. No issues at all.
Okay. So you mean to say that muscle strengthening is more important in this case?
Yes, absolutely.
Okay. Thank you, Mr. Doctor. One more question.
Sorry, Sapna Gorpade has asked a question. I'm a 44-year-old. When I sit for a long time, my knee starts paining, even above and below portion. I have not consulted a doctor still. Since 1 year, I'm experiencing it. Is it osteoporosis? Sapna, no, it is not osteoporosis. It is purely lack of activity, and you need to see a doctor appropriately and diagnose it rightly.
Hello, sir, I have a question.
Hello. Somebody, Deepa, you go again.
Yeah. Hello. Yeah, thank you. Sir, I have a question. I'm 47 years old. Actually, I used to walk for 10,000 steps per day, but suddenly what happened? Like after some time, I started getting knee pain. When I sit for a longer time and get up, I need little time to get settled down, like to walk freely. Then again, while at the time of climbing the steps, I'm finding I'm feeling some pain in the knee. When I got the scanning done, they said like one place, as you showed in the image, one place mein thoda gap is less. Then they said like it is osteoarthritis. I got little inflammation and all. I had gone for physiotherapy. Now that inflammation and all gone, and the pain is also not there. The only now I'm experiencing is that if I sit for a longer time and get up, then I get a pain. And if I climb the steps, I'm finding more than a climbing, while getting down, I'm finding the pain, sir.
That's right. So this is a very classical example of muscle weakness. Secondly, your arthritis already started. So arthritis, as you said, one episode has finished. The next episode might come somewhere at the age of another 1 year down the line or 2 years down the line. As you keep on going, the frequency of those pains reduces. Then you'll get once in 6 months. Then you might get once in 3 months, once in a month, and every day. So that is how arthritis behave. So as you classically explained, there is a wear on one side, and that is how you got the inflammation. You will benefit from the knee offloader brace or a half knee replacement. So if you consult, we will explain you how it works and what it does. And we would like to see the images or the x-rays prior to suggesting on those things.
Noted. Thank you, sir.
Thank you, ma'am. Maybe the next one.
Hello.
Uma, madam, you want to ask something? Because you are raised your hand, but you are not able. Mr. Anthony, you want to ask something?
Yes, doctor. Okay, Kannada is comfortable.
Kannadale ಹೇಳಿ ಪರವಾಗಿಲ್ಲ.
Okay. ಇವಾಗ ನನಗೆ ಬಂದು ಒಂದು 9 ಇಂದ ಆರ್ಥರೈಟಿಸ್. ಸೊ ರೀಸೆಂಟ್ಲಿ ನಾನು ಇವಾಗ ಎಕ್ಸ್ರೇ ಬಂದ್ಮೇಲೆ 9 years ಇಂದ ಇದೆ.
ಓಕೆ.
ಇವಾಗ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಕೇಳಿಸ್ತಾ ಇದೆ.
ಇವಾಗ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಓಕೆ.
9 years ಇಂದ ಆರ್ಥರೈಟಿಸ್ ಇದೆ.
ಓಕೆ.
ಓಕೆ. ಸೊ ನಾನು ಸುಮಾರು ಮೆಡಿಕೇಶನ್ಸ್, ಸುಮಾರು ಮೆಡಿಸಿನ್ಸ್, ಮಸಾಜಸ್ ಏನೇನ್ ಮಾಡ್ಬೇಕು ಎಲ್ಲ ನಾನು ಮಾಡ್ಬಿಟ್ಟೆ. ಸೊ ಲಾಸ್ಟ್ ಅಲ್ಲಿ ಏನ್ ಮಾಡಿದೆ, ನನ್ಗೆ ಶುಗರ್ ಬೇರೆ ಇತ್ತು. ಸೊ ಶುಗರ್ ಇದೆ, ಕೆಲವರು ಹೇಳ್ತಾರೆ ಶುಗರ್ ಇದ್ರೆ ಅದು ಇನ್ನೂ ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಇದು ಪ್ರಾಬ್ಲಮ್ ಅಂತ. ಬಟ್ ನನ್ ಕ್ವಶನ್ ಏನಂದ್ರೆ, ದ ರೀಸನ್ ಇಂದ ಆರ್ಥರೈಟಿಸ್ ಒಬ್ಬ ಮನುಷ್ಯನಿಗೆ ಶುರು ಆಗೋದಕ್ಕೆ ಕಾರಣ? ಇಸ್ ದಿಸ್ ಸ್ಮೋಕಿಂಗ್, ಇಸ್ ದರ್ ಆಲ್ಕೋಹಾಲ್, ಇಸ್ ದರ್ ಎನಿ ಫುಡ್ ಇದರಿಂದ ಆಗುತ್ತಾ, ಏನ್ರಿಂದ ಆಗುತ್ತೆ ಅಂತ?
ಓಕೆ. ಸೊ ನಾನು ಮುಂಚೆ ಹೇಳಿದ ಟಾಕ್ ಅಲ್ಲಿ ಆರ್ಥರೈಟಿಸ್ ಅನ್ನೋದು ಇದು ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಆಗತ್ತೆ. ಇದು ನಾರ್ಮಲ್ ಪ್ರಾಸೆಸ್. ನನಗೂ ಆಗತ್ತೆ, ಪ್ರತಿಯೊಬ್ಬರು ಇಲ್ಲಿ ಪ್ರೆಸೆಂಟೇಷನ್ ಪ್ರತಿಯೊಬ್ಬರು ಆಗತ್ತೆ. ಕೆಲವರಿಗೆ ಬೇಗ ಆಗತ್ತೆ 50ರಲ್ಲಿ, ಕೆಲವರಿಗೆ 60 ಆಗತ್ತೆ, ಕೆಲವರಿಗೆ 70 ಆಗತ್ತೆ. ಅಷ್ಟೇ ವ್ಯತ್ಯಾಸ. ಅಂದ್ರೆ ಪ್ರತಿಯೊಬ್ರು ಆರ್ಥರೈಟಿಸ್ ಪ್ರಾಸೆಸ್ ಅನ್ನೋದು ಈ ಪ್ರಾಸೆಸ್ ಹೋಗ್ಲೇ ತಗೋಬೇಕು. ಇದು ಕಾರ್ ಟೈರ್ ತರ. ಕಾರ್ ಟೈರ್ ಓಡಿಸಿದಷ್ಟು ಸೌದೋಗೋದು ಸಹಜ.
ಹೌದು.
ಅದನ್ನು ತಡಿಲಿಕ್ಕೆ ಯಾರಿಂದನೂ ಆಗಲ್ಲ.
ಓಕೆ.
ಆರ್ಥ್ರೈಟಿಸ್ ಅನ್ನೋದು ಹುಟ್ಟದ ಮೇಲೆ ಮನುಷ್ಯ ಒಬ್ಬನೇ ಅಲ್ಲ, ಪ್ರತಿಯೊಂದು ಪ್ರಾಣಿ ಈ ಪ್ರಪಂಚದಲ್ಲಿ, ನಾಯೇ ಆಗ್ಲಿ, ಬೆಕ್ಕೆ ಆಗ್ಲಿ, ಸಿಂಹನೇ ಆಗ್ಲಿ, ಪ್ರತಿಯೊಂದು ಕಾರ್ಟಿಲೇಜ್ ಇದೆ. ಆ ಕಾರ್ಟಿಲೇಜ್ ಲೈಫ್ ಹೋಗ್ತಾ ಹೋಗ್ತಾ ವೇರ್ ಆಗತ್ತೆ.
ಓಕೆ.
ಡಯಾಬಿಟಿಸ್ ಅನ್ನೋದು ನೀವು ಆಕ್ಟಿವಿಟಿ ಮಾಡ್ಲಿಲ್ಲ, ನಡೆದಿಲ್ಲ ಅಂದ್ರೆ ನಿಮ್ಗೆ ಡಯಾಬಿಟಿಸ್ ಜಾಸ್ತಿ ಆಗತ್ತೆ, ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಬರಲ್ಲ.
ಓಕೆ. ರೀಸನ್ ಏನಂದ್ರೆ ನಾನ್ ನಡೆಯಕ್ಕೆ ಕಾರಣ ಏನಂದ್ರೆ ನನಗೆ ಫುಲ್ ಸ್ಟಿಫ್ನೆಸ್ ಲೆಗ್ ಅಂಡ್ ಲೆಫ್ಟ್ ಲೆಗ್ ತುಂಬಾ ಜಾಸ್ತಿನೇ ಪ್ರಾಬ್ಲಮ್ ಇದೆ. ಸೊ ಇದರಿಂದ ನಾನು ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡಕ್ಕಾಗಿಲ್ಲ. ಬಟ್ ಏನಂದ್ರೆ ಇವಾಗ ರಿಸಲ್ಟ್ ಏನಂದ್ರೆ ನಾನು ಸ್ವಲ್ಪ ದಿವಸದಿಂದ ಇದು ಏನ್ ಹೇಳ್ತಾರೆ, ಹಿಂದಿ ಹೇಳ್ತಾರೆ ಹಡ್ಜೋಡ್ ಅಂತ, ಹಡ್ಜೋಡ್ ಒಂದು ಪ್ಲಾಂಟ್. ಆ ಹಡ್ಜೋಡ್ ಪ್ಲಾಂಟ್ ನಾನು ಇವಾಗ ಒಂದು 1 month ಇಂದ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಲೈಕ್ ಚಟ್ನಿ, ಲೈಕ್ ಹಡ್ಜೋಡಿಂದ ಆಯಿಲ್, ಇದನ್ನ ಮಸಾಜ್ ಮಾಡಿ ಇದನ್ನ ನಾನು ತಿನ್ನೋ ಇದ್ರಲ್ಲಿ ನನ್ಗೆ ಶುಗರ್ ಲೆವೆಲ್ ಕಂಟ್ರೋಲ್ ಆಗಿದೆ. ಯಾವಾಗ್ಲೂ 200 300 ಇತ್ತು. ಅದನ್ನ ನಾನು ಹೋಗಿ ಚೆಕ್ ಮಾಡಿದೆ, ಅದನ್ನೆಲ್ಲ ಬಂದು ಇದೆ. ನಾನು ನಿಮ್ಗೆ ಇದೇ ಗ್ರೂಪ್ ನಲ್ಲಿ ನಾನು ಕಳಿಸ್ತೀನಿ ಬೇಕಾದ್ರೆ. ಸೊ ಹ್ಯಾಸ್ ಇಟ್ ಇಸ್ ನೋಡೋಣ ಎಲ್ಲ ಆಯ್ತಂತ ಅಂದ್ಬಿಟ್ಟು ಅದನ್ನ ನಾನು ಯೂಸ್ ಮಾಡಿದೆ. ಸೊ ಅದನ್ನ ಆಯಿಲ್ ಮಾಡಿ ಅಪ್ಲೈ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ದೆನ್ ಅದಾದ್ಮೇಲೆ ಅದನ್ನ ಚಟ್ನಿನೂ ಮಾಡ್ಕೊಂಡು ತಿಂತಾ ಇದ್ದೀನಿ. ಬಟ್ ಏನಂದ್ರೆ ಇವತ್ತು ಟುಡೇ ನಾನು ಇವತ್ತು ಎಷ್ಟು ಕೆಲಸ ಮಾಡಿದ್ದೇನೆ ಅಂದ್ರೆ ಈ 9 years ನಲ್ಲಿ ನಾನು ಯಾವತ್ತೂ ಇಷ್ಟು ಕೆಲಸ ನಾನು ಮಾಡಿಲ್ಲ, ಮಾಡಕ್ಕೂ ಆಗ್ತಾ ಇರ್ಲಿಲ್ಲ ನನಗೆ. ಸೊ ಕಂಪ್ಲೀಟ್ ಇವತ್ತು ಒಂದು ನಾನೇ ಕಾರ್ಪೆಂಟ್ರಿ ಕೆಲಸ, ಕೂತ್ಕೊಳ್ಳೋದು, ಎದ್ದೇಳೋದು ವಿತೌಟ್ ಎನಿ ಸಪೋರ್ಟ್, ಏನು ಇಲ್ದ್ರ ಜಾಯಿಂಟ್ಸ್ ಇಷ್ಟು ದಿವಸ ನನಗೆ ಕೂತ್ಕೊಂಡು ಎದ್ದೇಳಕ್ ಆಗಲ್ಲ. ಬಟ್ ಇವತ್ತು ನಾನು ಕೂತ್ಕೊಂಡು ಎದ್ದೇಳ್ದು ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಸೊ ಈ ಹಡ್ಜೋಡ್ ಪ್ಲಾಂಟ್ ಇಂದ ಏನಾದ್ರೂ ಡಿಫ್ರೆನ್ಸ್ ಕಾಣಬಹುದಾ
ಸರ್? ಈಗ ನೀವು ನನ್ನ ಹತ್ರ ಬಂದು ಕೇಳ್ತಾ ಇದ್ದೀರಾ, ಈಗ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ ಏನಾಯ್ತು? ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ ಬಿಡೋಕ್ ಮುಂಚೆ ಒಂದಷ್ಟು ಟ್ರಯಲ್, ಜನಗಳು ಅದ್ ತಗೊಂಡ್ರೆ ಬದುಕ್ತಾರ, ಸಾಯ್ತಾರ, ಒಳ್ಳೇದಾ ಕೆಟ್ಟದಾ ಅಂತ ಈಗ ಒಂದು ಪದಾರ್ಥ ತಗೊಂಡ್ಬಂದು ಇಲ್ಲಿ ಇದು ಚೆನ್ನಾಗಿದೆ ಅಂತ ನಾ ಹೇಳಿದ್ರೆ ನಾ ಇನ್ನೊಬ್ರು ಕೊಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ. ಸೊ ಅದು ಎವಿಡೆನ್ಸ್ ಬೇಸ್ಡ್ ಮೆಡಿಸಿನ್ ಅಂತೀವಿ. ನೀವು ತಗೊಳ್ಳೋ ಪದಾರ್ಥ ಅಲ್ಲ, ನಾ ಹೇಳೋದು ನೀವು ತಗೊಳ್ಳೋ ಪದಾರ್ಥ ಪ್ರತಿಯೊಬ್ಬರು ಹೆಲ್ಪ್ ಆಗುತ್ತಾ ಇಲ್ಲ ಅಂತ ಒಂದು ರಿಸರ್ಚ್ ಪದ್ಧತಿ ಪ್ರಕಾರ ಮಾಡ್ಬಿಟ್ಟು ಅದನ್ನ ರಿಸಲ್ಟ್ಸ್ ಪಬ್ಲಿಷ್ ಮಾಡಿದ್ಮೇಲೆ ನಾನು ಹೇಳ್ಬೋದು ಅದು ಒಳ್ಳೇದಾ ನಿಮಗೆ ಚೆನ್ನಾಗಿದ್ಯಾ ಆಗತ್ತಾ. ಅದನ್ನ ಎವಿಡೆನ್ಸ್ ಬೇಸ್ಡ್ ಮೆಡಿಸಿನ್ ಅಂತೀವಿ. ಓಕೆ, ಎವಿಡೆನ್ಸ್ ಬೇಸ್ಡ್ ಪ್ರಕಾರ ನೀವು ಹೇಳೋ ಪದಾರ್ಥ ಬಗ್ಗೆ ನನಗೆ ಮಾಹಿತಿ ಇಲ್ಲ, ನನಗೆ ಜಾಣಕಾರಿನೂ ಇಲ್ಲ. ಸೊ ಐ ಆಮ್ ಸಾರಿ, ಐ ವಿಲ್ ನಾಟ್ ಬಿ ಏಬಲ್ ಟು ಟೆಲ್ ಯು ಮಚ್ ಇನ್ಫಾರ್ಮೇಶನ್.
ಓಕೆ. ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್. ಆಮೇಲೆ ಆ ಒಂದು ನೀ ಜಾಯಿಂಟ್ ಗೆ ಒಂದು ಕ್ಯಾಪ್ ನೀವು ತೋರಿಸ್ತಾ ಇದ್ರೆ, ಒಂದ್ ಸೈಡ್ ಸೋದೋದ್ರೆ ಇನ್ನೊಂದ್ ಸೈಡ್ಗೆ ಆ ಜಾಯಿಂಟ್ ಇದ್ ಮಾಡಿದ್ರೆ ಸ್ವಲ್ಪ ಲಿಫ್ಟ್ ಆಗುತ್ತೆ ಅದು.
ಹೌದು.
ಸೊ ಅದು ಬಂದು ನಿಮ್ಮ ಹತ್ರ ಸಿಕ್ಕುತ್ತಾ?
ಅದು ಆಫ್ ಶೋಲ್ಡರ್ ಬ್ರೇಸ್ ಸುಭಾಷ್ ಅಂತ ನಿಮ್ಮ ಹತ್ರ ಕನೆಕ್ಟ್ ಮಾಡ್ತಾರೆ.
ಹೌದಾ? ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Hello.
Thank you, Dr. Thank you.
Hello. Uma madam, you can stop. You are waiting for a long time.
मैं उमा खुराना बोल रही हूँ. मैं अभी जो है स्टार्टिंग प्रॉब्लम है आर्थराइटिस की, 1 और 2nd स्टेज, और मैं डेली 1 hour वॉक करती हूँ. लेकिन मैं जानना चाहती हूँ इसके लिए डाइट और एक्सरसाइज क्या होनी चाहिए?
डाइट, सिंपल डाइट, ज्यादा फैट्स नहीं लेनी चाहिए. मल्टीविटामिन तो अच्छा है आपकी जॉइंट्स के लिए
जी.
और वॉकिंग और बैठे बैठे क्वाड्रिसेप्स स्ट्रेंथनिंग एक्सरसाइजेस एक होती है जो
नी
आप
एक्सरसाइजेस. नी की एक्सरसाइजेस. ओके.
ये आपको हेल्प करेंगे.
बहुत मतलब भारी एक्सरसाइज ना करें, वेट वाली, जैसे कि ये मतलब जॉगिंग करना है या इस तरह की कोई ना करें.
वैसे की जरूरत नहीं है. आप खुद अपने से चलेंगे वही काफी है. उसके साथ बैठ के आप क्वाड्रिसेप्स का एक्सरसाइज करेंगे वही काफी है.
मतलब 1 hour तो मैं चलती हूँ डेली. अभी मैंने हाल ही में इंजेक्शन लगवाया है PRP का. तो उन्होंने कहा तो है कि आप मतलब अभी स्टार्टिंग स्टेज है तो आपका साल भर तक जो है निकल जाएगा इसमें.
सही बात है, सही बात. 1 साल, कुछ लोगों में 2-3 साल तक चल जाता है.
जी. अच्छा मेन चीज बस मेरे को डाइट की है। अब सब लोग कहते हैं वेट लॉस, लेकिन मेरा वेट तो बहुत कम हो गया है, मतलब बढ़ा नहीं है।
आप रेगुलर, अगर वेट कम है आपके हिसाब से तो आप रेगुलर डाइट खा सकते हो, कोई प्रॉब्लम
जी, मतलब मेन उसमें डाइट में क्या हम इंक्लूड ज्यादा करें?
प्रोटीन से आपकी जॉइंट्स हेल्थी रहेंगे।
ओके, थैंक यू डॉक्टर।
ಪ್ಲೆಷರ್ ಮ್ಯಾಮ್.
ಡಾಕ್ಟರ್, ಇಲ್ಲಿ ಒಂದು ಕಾಂಟ್ರಡಿಕ್ಟರಿ ಸ್ಟೇಟ್ಮೆಂಟ್ ಇದೆ. ಯಾರಿಗೆ ಜಾಸ್ತಿ ನೀ ಪೇನ್ ಇರುತ್ತೆ, whomever is having more knee pain, they should not walk and do not put more pressure on knee ಅಂತ ಹೇಳ್ತಾರೆ. ಅದು ಹೇಗೆ ಡಾಕ್ಟರ್ ಅದು?
Okay, so that is a wrong understanding, Deepa. So ಜಾಸ್ತಿ ನಡಿಕೂಡ್ದು ಆಕ್ಟಿವಿಟಿ ಮಾಡಕೂಡ್ದು ಅನ್ನೋದು ಬರೀ ಆ ಅಕ್ಯೂಟ್ ಫೇಸ್ ಪೇನ್ ಇದ್ದಾಗ ಮಾತ್ರ. ಈಗ ಆರ್ಥರೈಟಿಸ್ ಇದ್ದಾಗ ಇನ್ಫ್ಲಮೇಟರಿ ಪ್ರಾಸೆಸ್ ಅನ್ನೋದು ಆಗತ್ತೆ. ಆ ಫೇಸ್ ಅಲ್ಲಿ 1 ವಾರ 10 ದಿನ ಬಹಳ ನೋವು ಇರುತ್ತೆ. ಆ ಟೈಮ್ಗೆ ನಾವು ಮಾತ್ರೆ ಕೊಡೋದು. ಹಲೋ, can you hear me?
Yes, doctor, I'm hearing you.
So ಆ ಟೈಮ್ ಅಲ್ಲೇ ನಾವು ಮಾತ್ರೆ ಕೊಡ್ತೀವಿ, and that is the time we advise them to do not too much of activities and exercises. Once that settles down, we recommend them to do again.
Okay. So during even now
pain irutte.
Okay, doctor. So even if we do 10,000 steps also, because of rubbing, ಇದರಿಂದ ಇನ್ನೂ worst case ಆಗಬಾರ್ದು ಅಂತ I was just thinking.
ಇಲ್ಲ, ಹಾಗಲ್ಲ. ಕಾರ್ಟಿಲೇಜ್ ಅದು ಮುಂದೆ ಸರ್ವೈವ್ ಆಗ್ಬೇಕಂದ್ರೆ you have to keep active. But grade 4 arthritis ಇತ್ತು ಒಂದು ಕಂಪಾರ್ಟ್ಮೆಂಟ್ ಅಂದ್ರೆ ನೀವು ನಡೆದ್ರೆ ಇನ್ನೂ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, because the bone rubbing on the bone causes that. ಅದನ್ನ ಕರೆಕ್ಟ್ ಆಗಿ ಕಂಡುಹಿಡಿಯಲಿಕ್ಕೆ you have to consult the right specialist.
Okay, doctor. Okay, thank you.
Sir?
Yeah, you go ahead, sir.
ಹೇಳಿ.
ನಾನು ರೀಸೆಂಟ್ಲಿ ಆಪರೇಟ್ ಆಯ್ತಲ್ಲ ಸರ್, ಈಗ ನಂದು ರೈಟ್ ಲೆಗ್. ಈಗ ಅದು ಇಟ್ಸ್ ಗೆಟಿಂಗ್ ಪೇನ್ ವೈಲ್ ಕ್ಲೈಂಬಿಂಗ್ ದಿ ಸ್ಟೆಪ್ಸ್.
ಎಷ್ಟು ದಿನ ಆಯ್ತು ಸರ್ ಆಪರೇಟ್ ಆಗಿ?
ಈಗ 1 month 40 days ಆಯ್ತು ಸರ್.
Okay, so it is a good sign. Climbing up and down the stairs is because of the weak muscles. Operation ನಂತರ muscles ಒಂದು ಸ್ವಲ್ಪ ವೀಕ್ ಆಗುತ್ತೆ. ಈ ಮಸಲ್ಸ್ ಎಲ್ಲ ರಿಕವರ್ ಆಗುತ್ತೆ ವಿತಿನ್ 3 months process ಅಲ್ಲಿ. ಸೊ ಈ ನಾರ್ಮಲ್ ನೋವು ಅಪ್ ಟು 3 months ಇಸ್ ನಾರ್ಮಲ್. ಬಟ್ ನೀವು ಎಷ್ಟು ನಡೀತಿರೋ, ಎಷ್ಟು ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡ್ತಿರೋ, ಆ ಮಸಲ್ಸ್ ಅಷ್ಟೇ ಸ್ಟ್ರಾಂಗ್ ಆಗತ್ತೆ, ನಾವು ಅಷ್ಟು ಕಮ್ಮಿ ಆಗ್ತಾ
ಬರುತ್ತೆ. ಬಟ್ ಮಸಲ್ ಟೈಟ್ ಆಗುತ್ತಲ್ಲ ಸರ್ ಅದು?
ಮಸಲ್ ಸ್ಟಿಫ್ನೆಸ್ ಆಗೋದು ಪೋಸ್ಟ್ ಸರ್ಜರಿ ಅಂತ. ಸರ್ಜರಿ ಮಾಡಿದಾಗ ಏನಾಗತ್ತೆ, ಹೋಗತ್ತೆ. ಇಟ್ ಆಲ್ ಟೇಕ್ಸ್ ಅಬೌಟ್ 3 months ಟೈಮ್ ಪ್ರಾಸೆಸ್. ದಿನ ಕಮ್ಮಿ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಹೇಗೆ ನಿಮ್ಗೆ ಫಸ್ಟ್ ಡೇ ಅಲ್ಲಿ ಆಪರೇಷನ್ ಸ್ವೆಲ್ಲಿಂಗ್ ಇತ್ತು, ಇವತ್ತಿಗೆ ಕಮ್ಮಿ ಆಗಿರುತ್ತೆ, ಅದು ಮುಂದೆ ಹೋಗ್ತಾ ಇನ್ನೂ ಕಮ್ಮಿ ಆಗುತ್ತೆ.
ಈಗ ನನಗೆ ಒಂದು ಲೆಗ್ ಆಪರೇಷನ್ ಮಾಡಿದ್ರಿ ತಾವು, ಇನ್ನೊಂದು ಪೈನ್ ಅದು ಹಾಗೆ ಇದೆ. ಹಾಗಾಗಿ ಜಾಸ್ತಿ ವಾಕ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ. ಇನ್ನೊಂದು ಲೆಗ್ ಪೈನ್ ಜಾಸ್ತಿ ಆಗ್ಬಿಡುತ್ತೆ ವಾಕ್ ಮಾಡ್ಲಿಕ್ಕೆ ಹೋದ್ರೆ.
ಈಗ ಎಷ್ಟಾಗತ್ತೋ ಅಷ್ಟು ಮಾಡಿ, ಅದು ಸೆಕೆಂಡ್ ಲೆಗ್ ಮಾಡಿದಾಗ 2 ಈಕ್ವಲ್ ಆದಾಗ ಪೇನ್ಸ್ ಕಂಪ್ಲೀಟ್ಲಿ ಹೋಗುತ್ತೆ. ಎಲ್ಲರೂ ಬಹಳ ಪೇಷಂಟ್ಸ್ ತಾನಾಗ್ ಬಂದು ಕೇಳ್ತಾರೆ. ಒಂದು 3 months 6 months ಆದ ನಂತರನೇ ಅವ್ರಿಗೆ ಫ್ರೀ ಆಗೋದು ಕಾಲು. ಅವಾಗ ಅವರೇ ತಾನಾಗ್ ಬಂದು ಇನ್ನೊಂದು ಕಾಲ್ ಮಾಡಿ ಸರ್, ನನ್ನ ಕಾಲ್ ಬಹಳ ಚೆನ್ನಾಗಿದೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಫಸ್ಟ್ 1 to 2 months they always feel ಯಾಕೆ ಮಾಡಿಸ್ಕೊಂಡಿದೀವೋ, ಯಾಕೆ ಬಹಳ ನೋವಾಯ್ತು ಅಂತ ಫೀಲಿಂಗ್ ಬರುತ್ತೆ. ಅದು ಸಹಜ, ಅದು ನಾರ್ಮಲ್.
ಸ್ವಲ್ಪ ಪೇನ್ ಜಾಸ್ತಿ ಇದ್ರೆ ಪೇನ್ ಕಿಲ್ಲರ್ ತಗೋಬಹುದಾ ಸರ್?
ತಗೋಬಹುದು, ಏನು ತೊಂದರೆ ಇಲ್ಲ.
ಅದರಿಂದ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅವೆಲ್ಲ ಏನಾಗಲ್ಲ ಸರ್?
ಏನೂ ಆಗಲ್ಲ. Hello.
Sir, good evening, sir. My name is David. I'm a 50-year-old male. Actually, sir, I have pain in knee. It's kind of not while walking or something. When I sleep and bend my leg, so that time I get a pain. I did a MRI with cartilage mapping. There was some observations like They mentioned mild mucoid regeneration of ACL is seen, and degenerative changes seen in the posterior horn of the medial meniscus and all. Lateral meniscus appears unremarkable. And also, they
Giridhar, how old are you?
53 years.
Okay. Giridhar, what you're findings in MRI is normal for the age. We need to ideally have a consultation before I comment on what is the symptoms of yours. Okay. Cartilage mapping kanate cartilage where idya illa. Okay. So these kind of things will help you with good exercises, quadriceps strengthening exercise antivi. Those things will help you in terms of reducing the knee pain.
Okay. But it's not the arthritis or this one, right?
It might not be, but unless I know what is the result of the cartilage mapping, I'll not be able to.
Okay. Okay. Fine. I'll maybe I will consider. Just I wanted to just conclude. Okay, what would be?
Sure. Thank you. Thank you, Giridhar.
Thank
you. Anybody wants to talk to the doctor now? Any questions?
Sir, continuous painkiller is there any trouble for kidney, sir?
Illa, sir. So the painkillers what we give after the surgery is not causing any damage to the kidney. We give opioid-based family. So andre adu kidney inda hogode illa horagade, adu liver inda horagade hogutte. So kidney damage agalla. You don't have to worry.
Thank you, sir. Thank you. Thank you very much, sir.
Thank you, sir.
I have a question. How long does the impact of PRP last? I have grade 4 and I put 3 PRP shots.
Okay.
I don't think I got a lot of benefit, but normally does it really help at that stage? And how long will it remain?
Yes. So if the indications are not right, if you're not the right person to have put, so you'll not see the benefit. So normally people who have grade 1 arthritis and grade 2 arthritis, they do tend to get benefit, ranging anything from 6 months up to 3 years.
Okay. Okay. Thank you, doctor.
You're welcome. Any other questions, sir?
Thank you. Any other questions from? Okay. I think there is no question from the participants. Thank you very much, doctor.
Thank you, sir.
I have one question.
Thank you, sir.
Doctor, I have one question.
Yes.
You have shown that that cartilage what.
Yes.
See, I have a cartilage. So this is like you have to go under operation. You will do the operation, or that has some kind of this thing. Because I joined very late, so I didn't follow that.
Okay. Ma'am, what is your question? I didn't understand.
See, the problem is in my knee, there is a gap, okay? A small gap. Okay. That's what the doctor, and I got the x-ray done and all this thing. They said that's a gap. Okay. And for that, the doctor told emergency, you have to do surgery and all. But when I took second opinion, the doctor said not require that immediately surgery and all. It's very mild with exercise and all these things. It will gradually improve.
Okay.
Is that correct? Whether it will gradually, those cartilage will improve?
How old are you, ma'am? Don't mind me asking you.
I am 50.
Okay. Ma'am, you're still at a very younger age group. Okay. Yeah. So you might have arthritis. Again, you ask your doctor what grade it is and what stage it is. Okay. So arthritis will progress as you keep growing older. The wear and tear increases.
Okay.
When the wear and tear increases, that is where we talk about knee replacements and other things.
Oh, okay.
Okay. So surgery is not required if there is no pain or if you're not affecting your daily activities of life.
Actually, see, the problem with me is if I sit down, getting up is a problem. Otherwise, on my daily activity, I am okay. I do 25 to 30 Surya Namaskar and all other activities I do. I do my yoga and everything.
Very good. That is purely because of weak muscles. So it will help you with strengthening your quadriceps muscles.
Okay. So for that, do I have to take some medication for weak muscles?
Not required. You need to do exercises. You see a physiotherapy and they'll be able to do that.
Oh, thank you, doctor. Thank you so much.
Thanks. Somebody asked me a question: is osteoporosis different from osteoporosis different from osteoarthritis? Yes, they both are two different things. Osteoporosis are weak bones. Osteoarthritis is loss of cartilage. So they both are two different things.
Thank you very much, doctor. I think Mr. Venkat Ramanan he raised his question. He raised his hand actually. Sir, okay. You want to ask to the doctor now? Any questions, sir? Mr. Venkat Ramanan, sir? Yes, sir.
Yes.
You unmute and talk, sir. Sir, sir, you release the mic. Sir, please unmute the mic. Sir, your voice is not clear actually. You unmute. I think is cannot able to understand, sir. He's not able to.
Okay, fine. So I'll leave this here. Thank you very much for everyone joining.
Thank you,
Hope
I have a last question. So arthritis is pretty bad, but I have the problem only while standing. If I'm standing for some time, then only I have the pain. I don't have any other pain. So what could be the reason that only when I'm standing, there is a pain?
It is difficult to answer, sir. We need to see the MRI that you have done. Sometimes the cartilage defects can cause the pain while standing. So examining would be the ideal thing before we come.
Okay, so you have to do an MRI, is it?
MRI, and we need to examine you before.
Okay.
Can we get the off-road braces easily nearby medical stores?
No, they are not available, ma'am. They are very custom built. Very few companies in India do it, like Preg. Few other companies do Osor and other things. Very few companies do it, ma'am. One or two.
So can you please share the number and name in the group so that any person, if they need it, they can call them?
Yes.
Madam, after this program, we are going to share the details. You can register for a demo. We will arrange for a demo. Don't worry about that.
Okay. So one more thing I have to ask, that you told, because if walking is very helpful in the osteoarthritis cases, but many of the cases I have seen that while walking initially they was very good, but suddenly they got a click and they start having a pain, and after the diagnosis they got to know they're having osteoarthritis.
That is normal, ma'am, because when you walk, when you drive a car, the tire will wear.
Yeah. So that means because of the walking, the wear and tear is there, but the cartilage will get the fluid also because of that only. So both the things are contradict. So is it the same thing we should walk or not?
Sir. Sir, doctor, sir. Sir.
He is very desperate to talk to you, sir, actually. Just a minute.
Hello. Hello.
Sir, just a minute, sir. 1 minute. There is a network issue from the doctor side. Just a minute, sir. Yeah, doctor is joined now. You can ask.
Hello. Hello.
Sir,
hello, I'm Venkatramana.
Yeah.
I'm Venkatramana.
Yes, sir.
My wife is having arthritis, sir. Left leg actually there is swelling, and we went to orthopedic surgeons 2 times, and the orthopedic doctor told there is not immediately operation is required, and she can use that glucosamine and some diclofenac sodium and all those things.
Okay.
So, but again, after discontinuing the tablets, again she is getting that pain and swelling in the. So, this braces what you were telling in the initially, whether that will be useful for her.
For that, we need to see the X-rays first, sir. If there is only one side knee arthritis, that will be helpful. If it is a both compartment, it will not be helpful. For that, examining the patient, talking to the patient and correctly doing the tests such as X-rays will only be able to diagnose it right.
Okay, these braces will not be rather to say useful. Useful in sense helpful.
It is helpful only for people who have one compartment arthritis. Now, whether
My
your
wife
has one compartment.
One compartment, left leg only, she gets often this pain and swelling.
One leg is not then see, knee is divided into 3 compartments. You need to see me, sir. ನೀವು ಬಂದು ನಾನು ನೋಡ್ಬೇಕು ಇಲ್ಲ ಒಂದು ಡಾಕ್ಟರ್ ಯಾರಿಗೆ ಅರ್ಥ ಆಗತ್ತೋ ಅವ್ರು ನೋಡಿದ್ರೆ ಅವ್ರು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡ್ತಾರೆ.
ಅವಳಿಗೆ she completed 68 years, 69 entered now. So how far these braces will be useful anta nanu.
It will not be helpful. I will not be able to tell you unless I see the X-ray, sir.
Okay. So I will fix an appointment.
Yes.
ನೀವು ಅದೇ ನಿಮ್ಮ ಡೀಟೇಲ್ಸ್ ಗೊತ್ತಿದ್ರೆ ನಿಮಗೆ ಇಲ್ಲಿ ಲಾಸ್ಟ್ ನಲ್ಲಿ ಹೇಳ್ತೀರಿ ಅಂತೀರಲ್ಲ. So the details of hospital and all those timings, hospital. ಅದೇ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಎಲ್ಲಿ ಸರ್ ಇದು ಲೊಕೇಶನ್?
Sir, we do in 2 locations. Heart of Bangalore, Vidhan Soudha hatra ಒಂದು ಮಾಡ್ತೀವಿ, ರಿಚ್ಮಂಡ್ ರೋಡ್. ಇನ್ನೊಂದು ನಾರ್ತ್ ಬೆಂಗಳೂರು ಹೆಬ್ಬಾಳ ಹತ್ರ ಮಾತ್ರ.
ಅದೇ ನಾರ್ತ್ ಬೆಂಗಳೂರು ಸರ್, ನಾವಿರೋದು ಆರ್ ಕೆ ಹೆಗಡೆ ನಗರ್.
ಹೌದಾ? We can do in Sanjay Nagar. They will share, sir. They will share the contact.
Sir, already we have shared the details in the WhatsApp group, sir. Don't worry about that. We will share it. If you need any help, you can talk to them directly, sir.
Please. Thank you, sir. Thank you, sir.
Sir, thank you very much, doctor. Already
thank you,
more time, and thank you very much for everyone. I hope you got a lot of information about from the doctor. Thank you very much, doctor. Thank you.
Thank you.